Hi to everyone. So myself Janet Sunantha, nursing tutor from E.S College of Nursing. Today I am going to teach you about teenage and early pregnancy. First we see about the teenage pregnancy definition. It is defined as pregnancy occurring in underage or teenage between 13 and 19 years. In this case, the pregnant teen mother and child born are likely to suffer with emotional and economic problem. Early marriage. It plays an important in teenage pregnancy. If the female gets married early, definitely it will become obvious that she became mother in a early period. Early dating behavior. Dating of a teenage children has become common in nowadays. It will lead to the extreme case of leads of early pregnancy. They will enjoy rape on minor. Raising incidence of rape on minor has also increased the rate of teenage pregnancy. Lack of family bonding. Children who do not show close relationship with their family members more likely to go out indulge in such activities because of unhealthy environment. We have to have a very good bonding in a family setup. It will prevent this kind of early marriage. Intake of drugs. So intake of drugs and alcohol is also one of the causes. Under the intoxication, children get into such activities. Financial factors. So because of the poverty, so many of the mothers and fathers force the girl into get in a early marriage. Lack of contraceptives. If the marriage is done early and no contraceptive methods are used, definitely it can lead to the teenage pregnancy and can adverse effect on the baby as well as the mother. So still we have seen in so many area the traditional belief they are following. According to some societal norms, it is considered as good thing if girls become pregnant early after the marriage. It's a myth. It should be considered as a proof of her fertility. Effects of teenage pregnancy. We can see this image. So we have to make the children to go cross the school. So we should not make the children to go for the maternity hospital during their school life. High dropout from school. Teenage mothers are likely to drop out of schools, which leads to lack of proper education of the girl. So what is the next effort? It is the premature birth. Teenage pregnancy can lead to the premature birth of babies. The child can also be a low birth weight baby. Inadequate nutrition. So during the teenage, mothers are likely to get inadequate nutrition during for the further problems. Maternal and infant mortality. Teenage pregnancy result in many complications which can cause maternal death. Underdeveloped pelvis at the age can give the rise in the difficult birth. It can lead to the infant and maternal mortality and morbidity. Unfulfilled needs. There are many needs of the infant of teenage mother which remain unfulfilled if there is a poverty. She cannot meet the financial need of her children and also herself. Medical aid is also not provided sometimes. She herself not mature enough to understand the emotional need of the children. Health risk. Teenage mother is more likely to have anemia, pregnancy, induced hypertension, lower genital tract infections. Prevention of teenage pregnancy. A strong emotional bond should be maintained from the family members, and such children are less likely indulge in such activities. Emotional attachment of parents with their children is a strong force help the teens to avoid such activities. They can open up if the children are getting to the bad touch and good touch. They will inform to their mother and father in a free manner. Education. Programs can teach sexual health knowledge, how to use contraceptives and how to avoid the pregnancy in a early stage. So we have to educate. We have to educate the teenage girls to do not enter into such activities of early pregnancy and early marriage. Counseling. Program can offer one-on-one support from the responsible adult. If the family members are not supporting the mother, supporting the children, definitely they need a good counseling in a one-on-one support manner. Get Get information on birth control and sexual health from the health department. Participation in counseling and support program. Talk to the parents or guardians about the sexual health. Talk to parents about the sexual health. So we have to no to the child marriage. We have to say yes to the children's to going to the school. Children of young parents are at higher risk of child poverty, unemployment and low income. There are many communities that offer counseling and support programs to help to prevent the teenage pregnancy. Next we are going to see about the elderly primigravida. That means elderly pregnancy. So women having their first pregnancy at or above the age of the 30 to 35 years are called elderly primigravida. The types of patients. The patient with a high fecundity, a woman married late but conceived soon after the marriage. The second is patient with low fecundity, the woman married early but conceived long after marriage. So what is the complication because of the late pregnancy? Maternal complication. During the pregnancy, there may be a chance of abortion, preeclampsia, abruptoplacenta and uterine fibroids. Pregnancy-induced hypertension, gestational diabetes and is more common in the elderly primigravida. So post-maturity chances it will increase and IUGR, intrauterine growth retardation also will sometimes occur. So during the labor, preterm labor, prolonged labor, maternal distress, retained placenta increase the chance of cesarean section. Fetal complication. So the prematurity increase the chances of congenital malformation, operative inferences are increased prenatal morbidity and mortality. So what would be the management? The preconception counseling should be done not only for the mother. So we have to concentrate about the couple counseling. So patient is considered as high risk. So all the steps followed for the high risk mother should be kept in mind while giving the care in each steps. Patient require a meticulous antenatal supervision and should have mandatory hospital delivery. We should not encourage a home delivery. Only we have to concentrate about the institutional delivery. So vaginal delivery is possible in this case, but if the induction score is unsatisfactory, we have to choose a cesarean section should be done. Thank you.